Hello everyone. I've been talking about factors which are affecting men, and one of the major factors which is it's affecting a lot of men, it's the issue of erectile dysfunction. So anytime you realize you have erectile dysfunction, that is a symptom. That is a sign and symptom that you have an underlying condition. And when we talk about underlying condition, we talk about either you have high blood pressure, either you have high sugar levels, that is diabetes, either you have heart condition, or if you're a person who is aged between 25 years to 45 years, most likely you have an infection, which I've been talking about, known as prostatitis. Prostatitis is the inflammation of the prostate gland. It's affecting a lot of men. How do you get prostatitis? During intercourse, there are those kind of bacteria, those kind of virus, fungi, which penetrate through the urethra. And the first place to hit is the prostate. Once they hit the prostate, the first thing you do, you lose the strength. Once you lose the strength, now you start losing morning erection, you start getting weak erection, you start losing urge to have intercourse. All this because of an infection known as prostatitis. So if you are that person and you've been having this issue of erectile dysfunction, sometimes it might present with testicular pain, sometimes it might present with anal itchiness, or sometimes it might present with the pain in between the testicles and the anus. That's region we call it perineum. Sometimes it might present with pelvic pain, abdominal pain. All this is just because of an infection known as prostatitis. Most cases when you go to hospitals, you are told what you have is a UTI. It's true, you have UTI, but the source of this UTI is the prostate. And again, the reason why the prostate is very common is because to treat prostate is not like treating any other kind of infection. Prostate takes more than 3 months to treat the prostate. The reason is because the shell or the outer protective layer of the prostate is very hard for this kind of normal medication to penetrate. That's the reason why it takes time to treat the prostate gland. And people who have this issue of prostatitis, they are also at higher risk of getting BPH later from 50 years and above. And you know, people who have BPH, they are also at higher risk of getting prostate cancer. So if you're watching me and you have this issue of prostatitis, erectile dysfunction, and you've been treating it for more than 1 month, it keeps coming back, you are having UTI, it keeps coming back, you're having urethral itchiness, you're having itchiness at the tip of the penis, that is a sign and symptom that you have prostatitis. And it's very risky because people with prostatitis, they produce infected sperms. These infected sperms, they might bring in the issue of infertility. You might bring in the issue of anytime you have intercourse with your partner, she might start feeling burning sensation. So later on, it can also risk the issue of getting your partner getting blocked fallopian tube. So if you are watching me and you have the symptoms I'm talking about, you can contact me through my secretary number is +254 723 632 448. That is my secretary number. Contact that number. We have a link. You can book the appointment through that link and we'll have one-on-one conversation with you. Thank you very much for your time. Thank you. No, kata hiyo.